So in this video I'm going to talk about my ectopic pregnancy, which was my very first pregnancy. I was just 25 at the time. I'm still 25 right now, but my birthday's in July, and I believe I had my ectopic pregnancy in August. I should probably have gotten my Flow app up because that's where I did jot quite a few bits and pieces down. First, when I knew something wasn't right, I'd be laying here on the couch and I'd be laying on my side, and at this stage I didn't know I was pregnant, and I could feel something on my right hand side, like I can sort of show you. I'd feel it like maybe there, right sort of in the groin area, there. And was it there or was it more up? Sort of between there and there. Probably more towards the groin though. And just getting comfy with pillows. I got there and I'd say to my partner, Ben, I'd say, I feel something there, and I'm there on Google, like, I swear I've got health anxiety. I also suffer with really bad UTIs, and then it's like, oh, you know, something's wrong with your bladder, and I'm like, oh God. But, you know, I got there and I drank plenty of water and that kind of stuff, and I didn't have a UTI, so I'm like, huh. And, yeah, so I just feel something, and then Ben would get there and say, oh, is it because you're lying on your left-hand side, so that side's sort of scrunched up? And I'm like, well, no, because I always lie on that side of the couch, like always, you know, so that'd be weird. And then, I guess a couple of weeks later, I took a pregnancy test, because at the stage, like I said, when I felt something there, I didn't know I was pregnant. So I took the pregnancy test, and it said, it was one of those digital ones that tells you how many weeks you are, and it said 2 to 3 weeks. And I got there and I took it privately in the toilet. Then I went out when we were having a coffee, and I said, oh, you know, I got there and I just had to, actually, no, I came outside. Did I come out here into the kitchen? He was making a coffee. I'm trying to think how it went. Anyway, it was one of the two, the outside, and told him, well, here. I had a big smile on my face, so I couldn't keep the grin off. And he got there and he goes, you're pregnant, aren't you? And I went, yeah. And I showed him the pregnancy test that I had in my dressing gown pocket. And so at that stage I'd sort of forgotten, because it became so normal to feel something there. And I just forgotten, and we were happy. We were so happy, we were ecstatic, we were over the moon, you know. But I got there and I said, let's not get too excited, just in case, because you can always, you know, have a miscarriage. I'm still extremely early on, 2 to 3 weeks. The next sort of thing was, I had a tiny dot of blood, like I mean a dot, and that made me go, you know. And I don't know if I started also having the feeling on the right hand side again, but I went, oh. I said, but I've got a dot, like a dot, even though it can be completely normal to spot during pregnancy, like it can be completely normal. You still have a healthy baby. But first time pregnant, had felt the little twinges or whatever people like to say on the right hand side, and I've had a dot sort of spotting. And the next day, or the day after, another spot, and I got there and I went, oh, you know, didn't make me feel good. The next thing was, we'd be outside gardening in the yard or whatever, and I got cramps, and I got there and I went, oh, I said, Beach, like, these are cramps, like I can feel something that doesn't feel nice. And straight away I sort of went to, like, I'm having a miscarriage. And one time I think it was the same day we were doing gardening, I came inside and I went to the toilet and I just started crying. It's like not an instinct, but I just thought something's wrong, and I just assumed I'm having a miscarriage, and I started crying because I thought, oh, I hear, you know, not the best of stories, like you get there and you have miscarriage after miscarriage after miscarriage. And I thought, oh, can I not have a baby? My mind just instantly went to the worst, you know, really negative headspace. And then one time I was in bed, and it would have been 2 o'clock or whatever in the morning, and I was in excruciating pain, like the worst pain I've ever felt in my life. I curled up into a ball and I couldn't move. If I moved, it would hurt, like really badly, and it lasted maybe, it was 15 minutes, half an hour. Anyway, I went back to sleep after it ended, and then I woke up and I told Ben about it. Started sort of Googling symptoms, and I'd watched this YouTuber and she'd had an ectopic, but I don't think I knew what it meant, but I'd heard of ectopic, and I Googled ectopic, or I either Googled my symptoms, you know, pregnant, feelings on the one side, and instantly it popped up ectopic pregnancy. And I thought that sounds, that's, the symptoms are so on par with what I'm going through. I thought I think this is what I'm having, an ectopic pregnancy. One time I'm at work and I'm trying to think if I'd been to the doctors or not just yet. And maybe at this stage I could be around 4 to 5 weeks pregnant or so. I was at work and I went to the toilet and there was a lot of blood, and it was thick. It was like, I guess you could say sort of clotty but sort of stringy. And it had this, it wasn't your normal, menstrual period blood smell. Didn't smell like that. It smelled, I explain it like it smelled chemically. So unusual. I've never smelled that smell in my life before from my blood. Chemicals, like very chemically, not normal. And then I don't know if I'd already been to the doctors or I hadn't, or I went to the doctors. So I went to the doctors, got a referral for an ultrasound. She tried to get me in that day. They were fully booked out, couldn't get me in that day. So it was either the next day or the day after. So I went in for my ultrasound. I've gotten into the appointment. I'm in the room. She does it on my tummy. She goes, "Oh, we're going to have to get there and do an internal." And I'm like, "Oh, for God's sake, it's my first time getting an ultrasound. Now I've got to get an internal." And she was a lovely older lady, but anyway, we're there, she's there looking around inside, all that kind of stuff. And she goes, "Oh, I can't see anything where it should be. Like, I can't see anything where it should be. The pregnancy, if it was healthy, it's not there. But at the same time, it can still be too early to see anything, because you can have a healthy pregnancy and not even see anything until later on in your pregnancy." So at this stage, I'm 5 weeks and 6 days. So she's there and she's looking, and then she sees something on my right ovary, or my ovary / tube, whatever. And she goes, "Oh, this doesn't look right. Your ovary doesn't look right." And I'm like, "Oh, okay." And then I don't know if I said to her, "Does it look like an ectopic?" She goes, "It could be. You go sit out in the waiting room, fix yourself up, go out to the waiting room, and I'm going to go talk to another doctor, whatever, send him the images and see what he thinks." So I waited in the waiting room for 10 minutes or so. The waiting room where everyone else was waiting for the x-rays, ultrasounds, whatever. And there was about 6 other people there. And I don't know if it's because she's older and she just didn't think, or it's completely normal to her. She comes up to me in front of everyone and she's loud. And she goes, "You're having an ectopic, darling. You're going to have to get there and go to the emergency hospital right now." And I'm just like, well, she goes, "You're having an ectopic. You're going to have to go to the hospital emergency room." And I went, "Oh, okay." Like, all these emotions just came over the top of me. I went, "Oh, okay. When do I have to go there?" She goes, Now. And I started crying in there. Not a wreck, but I was crying, and I'm slightly embarrassed because she's just spit this out in front of everyone. She could have taken me into the back room or back into the room and told me. And I sort of had to wait there for another 5 minutes to get this form, so when I go to the emergency, they can just send me straight in. No stuffing around sort of thing. I've called my partner up, who's just waiting outside, but he's up a little bit because of the parks. He's up the main road just a little bit because he couldn't get a park. I called him. I said, "Oh, I've got to go to the emergency hospital right now," and I'm in tears, and he goes, "Oh, what's up?" And I said, "Oh, it's an ectopic and I have to go right now. I'm just waiting on this little form. So when I get to the hospital, it's straightforward and easy." And I've grabbed the form, and people's looking at me because I'm crying. I sort of had to excuse myself and go outside for a little bit, but it was just shit. It sucked. Yeah. Anyway, I've grabbed the form, hopped in Ben's car, and he's taken me straight to the hospital. I've gone up to the normal hospital area, and I've said to him, "Oh, I've not been to the hospital at all, really. Like, I know where the emergency room is, but I don't know if my head was a bit sort of all over the place." I went up to the normal area, And he goes, oh, you got to go down here, down here. He must have read my form. Anyway, he's taken me down to the emergency department. And I think I sat in the waiting room, so you know the emergency room waiting area before we actually go into the emergency area. And I thought, oh God, how long am I going to be in here for? I was in there for 5 minutes, and normally you can be in there for hours and hours and hours. So that sort of also said that this is serious. They're not stuffing around, they're getting me in straight away. Sat in front of the little reception desk, and she's got they've got my details and all that. They've put me straight in. Then people have came and talked to me, and they sort of asked me questions, you know, basically what I've already told you guys. And then they told me what they're going to do. They said, okay, we're going to take your blood levels, check your HCG levels, see where they're at, so we can sort of get a, sort of, I don't know, like if they're trying to see, my numbers should be higher if it's a normal pregnancy. I don't know. They just wanted to get that as a baseline, I guess, you know. So if it is ectopic, you know, whatever we do today, that's the first time I've had my HCG, and we'll go from there, because you want things to drop and eventually get to zero sort of thing. So they've taken my bloods, and then they left it in my arms, the cannula, whatever. They left that in my arm, and far out. They said you can bend your arm, and I did, because I'm watching movies or whatever. And when you go to straighten it out, that's pain. Anyway, I've had multiple doctors come and talk to me. I had this young little, what are they? Is it when they're training or something like that? And he was a young fella, and he got there and said, oh, do you mind? Like, just asking me questions. It's to help him learn. And realistically, an ectopic's sort of a rare occurrence, so it's really good knowledge for him, you know, nurse to be or whatever. So I let him in, and I talked to him. I ran him through everything, just what I've ran you guys through, ran it all through him. He said he'd ask certain questions again. I said, yeah, you know. I didn't mind that, because I was already in there for a couple of hours, and I knew I was going to be in there for either the night or whatever. And anyway, another doctor came in, and she told me my ultimatums. She goes, so basically, depending on what your blood, that's right, depending on what my HCG levels were, blood test, I have 2 options of what we can do. So if they're low enough, I can have a needle, and that's called methotrexate, which is a form of chemotherapy. And that also treats arthritis, which is, you know, it's kind of a sort of amazing drug in that sense. It treats arthritis, and it makes things a lot easier for people with arthritis, whatever. But for me, what it does is it kills off your folate levels, or your folic acid levels, which in turn kills your pregnancy off. It stops your pregnancy from growing, because obviously the pregnancy is not where it should be. It's on my tube or my ovary or whatever. Other alternative was to get my tube taken out, and they told me about methotrexate. They said it can kill your good blood cells, and it can weaken your bone marrow. It can damage your liver or your kidney. You can have hair loss. As they have to run you through pros and the cons, basically. And they said, oh, if it doesn't work the first time, you'll have to get it again, and then potentially a third time. And if that all doesn't work, you're going to get your tube taken out anyway. I'm there, like, and then she got there and she had a tube out, which, you know, obviously I've only got 1 tube to work with if I want to get pregnant. Which, you know, you can still fall pregnant with 1 tube. It's not, like, it's not impossible. You can still, I think you still got 75% chance. But I was there weighing up all the cons with methotrexate, and it freaked me out. Like I said, I feel like I've got health anxiety. You know, when weaken your bone marrow, that sounds scary. Sounds horrible. And all the other things, like, you know, liver failure and all this kind of rare stuff. And then my partner, because I told him how I felt over the phone, I said, oh, this is what this methotrexate can do. And he's Googling stuff. And when you Google, you will see what you want to see. And you'll see all the horror stories. And I'm like, oh, far out, this is scary. I think I'm going to get my tube taken out, because what if I have methotrexate, it doesn't work, need it again, need a third time, then I get my tube. Might as well skip all the BS and get the tube out. Anyway, I called my mama, and I'm so glad I did. Make sure if you're ever in the same scenario as I am, call your mum up. Mum was thinking very, I don't know, not level-headed, because Ben and I were, But she thought, she got there and I ran her through everything, and maybe I was nearly trying to manipulate her, like, oh, this is what the methotrexate can do, that's scary, it can do this and that. And she got there and she goes, get in your tube. I said, I think I'm going to get my tube out. And she goes, what? She goes, no, you're 25, no. She goes, no, I wouldn't be doing that. She goes, no way. And I said to her, but this is what methotrexate can do. She goes, no, you're way too young to get your tube out, way too young. Like, if you don't need to, no. And I got there and I thought about it, and I was getting my tube out. That was my decision. And when this doctor came back, I asked her questions again. I said, so this liver damage, I said, is that permanent? If it does, she goes, no, it'll recoup and repair itself. It's not permanent. The other stuff's rare. It's not a guarantee that all the cons are going to happen. You know, it's not a guarantee. You could get there and have it and be completely fine, So I got there and I went with the methotrexate. They don't stock methotrexate at the hospital. They've called up a pharmacist, and I think she was in bed at home. Like, it blows my mind how this works. She got up, went to, unlocked her pharmacy or whatever, bought methotrexate in for me, and so I could be administered with it ASAP, because, you know, because if you don't do anything about ectopic and you leave it long enough, you can rupture and have internal bleeding. And that's what my mum told me. She goes, yeah, like, you know, you can get there and you can die. Like, and this was after the fact when I'm out, and I was like, I didn't know that. That's why they were treating everything so seriously. They'd ask me, how far away do you live from home? Around 30 minutes? And I went, yeah, I guess. Because if I go home and then I rupture, I need to be into the hospital within 30 minutes. And if I was more than 30 minutes away, I don't think they would have offered me methotrexate. They would have said, we're taking it out, the tube out, to cover their backs and also mine, so nothing serious happens to me. But, so yeah, I got there and, you know, I got into the hospital probably around 5 or 6 p.m. and methotrexate didn't come till around 10 p.m. Anyway, the methotrexate got delivered. I remember seeing the lady, and I feel like they bought 2. I don't know if methotrexate comes in 2 needles or she bought 2, because I have a feeling there's a weight range. They weighed me and everything in there to see how much they need to administer me, and I don't know if I was on the border of sort of the weight limit, or they got there and she just bought in 1 and a bit needles. I remember getting 1 and a bit needles, so I've had more than enough for it to get there and start to do its job. It's changed shift, different nurses, they've came in and they said, oh, we're trying to get a hold of someone from the cancer department, not cancer department, but like chemotherapy, who runs that kind of stuff, who know how to administer chemotherapy, because they ran it through me, past me, and they got there and said, oh, it's not just like giving you a normal needle. We need to mask up, we need to hazmat up, and it goes into, you know how you normally have the yellow needle boxes? This one went into a purple box. So it's not your average needle. Anyway, they've hazmated up. They got there and said, no one's coming from that area that knows how to administer it. We have to do it on our own. And it sort of freaked them out, which freaked me out. Because I thought, oh, you want to administer chemotherapy to me correctly. I don't want to have to come in and get another dose, like, for the sake of not needing it. Anyway, they've got there and jabbed it in my thigh, and then they did another needle, and that was all fine, didn't hurt or anything like that. A tiny bit of sting, like you feel with a normal needle, but that was fine. They like to watch me for half an hour after, and guess in case something happens. Nothing happened, I was completely fine, went to the toilet and all that kind of stuff. And they said I could stay the night, but I thought, what's the point? Like, poor Ben has to come out and get me at 11 p.m. at night. But I thought, I'm in the emergency department, I'm all good, I'm done. I can go home and give this bed to someone else, because there's people out there waiting. So I've gone home, and they gave me a little list of things, you know, like notes sort of thing about when you've had chemotherapy, when you've had methotrexate, what not to do sort of thing. So basically you can't go out in the sun because your skin can become sensitive. So like, to, you know, the ultraviolet lights, you can burn easy, that's not a big deal. No eating foods high in folic acid. We put in all our foods and all that kind of stuff, so when you're trying not to eat it, makes it hard because it's in everything. So that was hard because I took that so seriously because I was adamant I didn't want to go get another needle. But we don't know if that plays a big role or not. But I nearly deprived myself of folate/folic acid, deprived myself of it. Also, things that you can't do. When I'd go to the toilet, I had to close the lid. I mean, this seems pretty straightforward, but when you think about it, it makes me realise that that needle sheds. It sheds. So when I'd go to the toilet, I had to close the lid and flush it. And I had this little antibacterial sprayer. So I'd spray it inside the toilet, close the lid and flush it, because that can get there and like shed onto Ben, people that are close to me. All my undies to be washed separately and on 2 washers. My bodily fluids were basically like, I guess, infected with, this methotrexate. So, no kissing, no this, no that with Ben. What do they say? Could have, obviously, because I was going through ectopic, no sex for like, I don't know, it was 3 days or a week or something like that, but definitely no unprotected sex because of my bodily fluids. And that blew me away. That, like, I'm like, wow, this must shed. This must be some toxic stuff. Naturally, if it can kill cancer cells off and it's a form of chemotherapy. Crazy. So, and then after that, you have to go get your bloods done every week. So I'd go get my bloods done, and then I'd go over hospital appointments, and we'd see. I'm trying to think, what were my levels originally? I think they were only like 700 and something, and they had to drop a certain amount the first time I went to my doctor's appointment, a hospital appointment, after, receiving the methotrexate. They had to have dropped to, they wanted them at least, I can't remember what it was. They had to drop by 100 and something for them to be satisfied with, that it was going to work. Otherwise, they need to give me another shot of methotrexate. Anyway, I went in there and I feel like originally they were like 700 and something, and they dropped to 612. And she goes, oh, they've just dropped enough that I'll give you another week, go get your bloods done again, come back in, and we'll see how you're going then. And that made me sort of nervous. I thought, oh, they're not dropping like they should be. Like they've just reached it. Anyway, bloods again, go back to the hospital appointment. They've dropped significantly this time. Don't know if they'd gone all the way to 400 or something like that, or 500, and they were happy. Do this again. Bloods again another week later, every Tuesday, bloods, then doctor's appointment, hospital appointment, and they've dropped again. And I was just getting stoked. I was so happy. I'm like, yay, everything's going how it should. After that, they would do phone appointments with me because they said, oh, there's no point you coming all the way in to the hospital. Might as well just do phone appointments. And everything was going really well. Everything got there and eventually dropped to, was it -0, or however that works. Yeah, so everything went well. Everything dropped back to how it should. So you can't try to fall pregnant again for 3 months after you've received methotrexate because it's a form of chemotherapy and that can cause birth defects to the baby, things like that. I ended up waiting, and COVID got really bad, and I ended up waiting to try to fall pregnant again because the hospital stressed me out. I thought, oh, if I fall pregnant during these COVID times, it's just going to be hectic in there. Anyway, I got there and changed my mind, and I thought, well, what if it doesn't change, and here I'm waiting, there's all this lost time that I could be pregnant. I started trying for another baby. I think it literally just stopped recording then. I was thinking of what I was trying to say, but I can't remember what it was. Yeah, anyway, I ended up waiting well and truly past the 3 months, so I knew that the methotrexate was fully out of my system. So I got there and, trying for a baby as of recently, sort of thing. Anyway, I got there and went to the toilet, say about, 3 and a bit months ago. I went to the toilet, weed in a little stick, and it said pregnant, same, 2 to 3 weeks. And I had been having twinges on the right hand side, and this, I just got so upset because that's right, they got there and said you've got a 1 out of 10 chance of having another ectopic. And the doctor would try and, rest assured, she goes, 1 out of 10, she goes, you've got all those 9 other chances of it being a healthy, normal, viable pregnancy, so don't stress yourself out too much. So I'd been having these right side twinges, and that sort of freaked me out. And I hopped on these Facebook groups. So I asked, I said, has anyone had ectopic, you know, and then gotten pregnant again, had twinges on the same side as their ectopic, but gone on to have a healthy, normal pregnancy? And lots of people said, yeah. I don't know, someone said, I don't know if it was the egg going through the tubes and it stretches, or it just is stretching and healing and you can just feel it. Some people would say, because you had an ectopic, you were just expecting the worst. So every little thing you feel, I relate to ectopic pregnancy. Anyway, I got there and, you know, I told mum, and I got there and I said, I feel like I'm having another ectopic, you know. So I wasn't happy. I was sort of deflated. I was probably 60% and then 40%, but what if it could be, you know, healthy? Anyway, I went to the doctors and I was, I think, 3 weeks, and she goes, I can't even send you for an ultrasound. I'd like you to wait as long as possible, ideally around 5 to 6 weeks. One, if you go in, you know, it could be a healthy pregnancy, but too early to even see anything, so then you sort of have to go again and waste your money. I actually held off and waited. I'd have these right side twinges, and, you know, I got there and I went, oh. And then I started to have nausea. I'd feel like crap, and I could feel stuff, and I'm like, oh, I don't feel well. I feel like I'm going to go spew. I wouldn't spew, but I feel crap. Anyway, I went in for my ultrasound. So they call this a placement scan to see whereabouts the pregnancy is, if it's in the right spot. As soon as she put it on my tummy, she goes, oh, congratulations. It's, you know, it's where it should be. And I was so over the moon. Still early days, but I thought I was 5 weeks, 6 days. She goes, you're actually 6 weeks, 6 days. She goes, no, everything looks fine. Everything looks fine. She got there and did an internal as well, just to be sure. And she goes, no, everything looks good. And I could hear the heartbeat, see the heartbeat. I think it was like 138 beats per minute. So everything's, you know, so far so good. As of today, I'm at 12 weeks and 5 days. So I'm pretty well at the safe, you know, sort of safe mark, they like to say. Tomorrow I go for my 12-week scan. So tomorrow I'll be 12 weeks and 6 days. On every Saturday is a week, so on Saturday I'll be 13 weeks, but tomorrow's my scan. That'll be exciting because Barb will be a lot bigger. Yeah, so I'm stoked for tomorrow. But yeah, I got there, and recently yesterday actually I went and did the NIP test, so non-invasive prenatal test, which is just a blood draw. And that tests for the baby's chromosomes, you know, things like Down syndrome, and then also tells you the baby's gender. So that'll take maximum time frame 2 weeks, but I could know in like 6 days or so. So we'll wait and see for that. Hopefully everything tomorrow goes well and baby looks how baby should be, measures correctly, all those kinds of bits and pieces. But so far so good, and I'm really excited because I honestly thought I'd never be able to fall pregnant. Like, it puts you in such a negative mind space. So for other people that have had an ectopic, know that there's more than hope for you. You can fall pregnant and have a baby. There's hope. Don't be so negative like I was. It's not fun. Enjoy your pregnancy. Yeah, like once you've got that placement scan, Bub's in the correct place, enjoy it. Yes, you could get there and have a miscarriage or whatever, but you're in the same boat as everyone else, you know what I mean? Once you've got the placement scan and Bub's where she should be, enjoy it. Don't hold on to this negativity. It's not fun. You want to have enjoyed your pregnancy. But yeah, so far so good. Bring on tomorrow. So mum's coming tomorrow, and I'm going to actually get her to film quite a bit of the footage. Like, they didn't give me a photo for my initial placement scan, like a little scan photo, so I really want the photo tomorrow where I'm 12 weeks. And that'll be my next video, probably a little update on how that ultrasound went. My mum has gone crazy with buying stuff, like I mean crazy. So I think next video will be showing you some of the stuff that we've got in the nursery. It's not a nursery at the moment. The room's a mess. We've cleaned it up a bit actually, but it was like a junk room. I'd throw crap in there. So I've got to sell stuff, get rid of stuff, clean it out. But once I know Bub's gender, it's when it'll become a nursery. But at the moment, there's a lot of stuff in there for Bub. But yeah, that will be another video, I think, where I get there and show you all the bits and pieces. As well as tomorrow, it can be a little update video But yeah, I hope you guys enjoyed this video. It's my first time recording with me on camera for a YouTube video. Hope you like it. Yeah, yet to figure out a YouTube name, channel name. It'll just be something simple, I'm sure. But if you've liked the video and enjoyed it and you have any questions, leave them down below in the comments section, and please subscribe and give this video a thumbs up. I'd really appreciate it. And enjoy the rest of your day, guys. Talk soon.